Good day, I am Princess Sheila Jane Vidal from BSN 111. And today I am going to perform a parenteral drug administration return demonstration using the subcutaneous and intramuscular injection. Prior to the conduct of the procedure, the first thing to do is to check the doctor's order on the patient's medicine administration record, which is done to identify what kind of drug to be given to the assigned patient, identify the drug's name, its dosage, routes of administration, and time it is to be given. Now we also need to follow the 3 checks for administering medications. Read the label on the medication. 1, when it is taken from the medication card. 2, before withdrawing the medication. And 3, after withdrawing the medication. To prepare the medications, we need to have syringes. So I have an insulin syringe for the subcutaneous injection and a 23 gauge syringe for the intramuscular injection. I also have aspirating needles, and we have sterile water, which will serve as the medication vial used in this demonstration. Of course, we also have a medication ampule. I have a gauze pad, a alcohol prep pad, and cotton balls, and most importantly, the waste receptacles to dispose of used needles and syringes to avoid needle prick injuries. After gathering the equipment needed, I'll perform hand hygiene to deter the spread of microorganisms and avoid cross-contamination. Now for subcutaneous injection, we will be preparing medication from a vial. First, we'll have to read the doctor's order and compare the medication in hand. Now, to prepare for the medication for subcutaneous injection, we need to open the insulin syringe and take it out. And remember to only touch the barrel and the plunger of the syringe to avoid contaminating the needle. If the syringe is capped, then remove the cap first because we'll have to connect the syringe into the aspirating. And now secure and sure connection is in place. Set it aside, then open the medication vial. Now that the rubber seal of vial is exposed, clean the surface of the rubber seal using the alcohol prep pad and do this for at least 30 seconds. Now take and uncap the syringe and draw into the syringe, drawing air just with the exact amount of the medication ordered by the doctor. Now drawing air just with the exact amount of the medication ordered by the doctor. Now inject the air into the vial. Now invert the vial and draw the medication up to the exact amount needed. If there is an air bubble, then slightly tap the barrel. Now we remove the aspirating needle and place it with the right size needle that will be used in the actual administration of the medication. the aspirating needle used in a waste receptacle to avoid needle prick injury. And write the medication ticket, name of the drug and dosage so that we won't forget what medication was drawn into the syringe and we won't get confused. Now for intramuscular injection, we will be preparing medication from an ampule. I'll just perform hand hygiene first to deter the spread of microorganisms and avoid cross-contamination. Now first we'll have to read the doctor's order in the MAR and compare the label on the ampule to make sure that it is the right medication being prepared. Now prepare the medication ampule for drug withdrawal. Inspect it and make sure it has no crack. Next, I'm going to lightly flick the upper stem of the ampule several times with a finger. Take the alcohol prep and clean the neck of the ampule to help prevent contamination and let it dry. Now, while waiting for it to dry, we'll get the syringe and replace it with an aspirated needle. Now secure and ensure that it is tightly tight. Now it's time to break open the ampule. Take the clean gauze and wrap it around the head or neck of the ampule. Now break off the top by bending it away from our body and away from others. Now dispose the broken piece of the head and neck to the sharps container as well as your gauze. Now we're going to withdraw the medication from the ampule. This time we don't have to inject air or inside the ampule. Make sure that the ampule is on a steady, flat surface using your fingers to hold it. Now we're going in and withdrawing the prescribed amount of solution, so the doctor ordered 1 cc of medication. Now remove and turn the syringe upright and flick it to get air bubbles out. Push up the plunger slightly to the prescribed amount and then remove the aspirating needle and dispose of it to the sharps container. Place it over the medication tray until ready to administer the medication. Also write the medication ticket, name of the drug and dosage so that we won't forget when medication was drawn into that syringe and we won't get confused. Now place it on the medication cart. The first procedure that I'm about to perform is the subcutaneous injection. It is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. First, check the doctor's order for the patient's chart. Okay, so good morning, ma'am. I am your student nurse for today. I am Sheila Jamie Dolahera. And so before we start, can you state your complete name and your birthday, please? Okay, Ms. Leia, so today I'll be administering your medication through your parenteral route. So, will that be alright with you? Yes. Okay, so I've already prepared your medication earlier. I'll just provide you a receipt. So, I'll start administering through your subcutaneous injection. I'll be injecting insulin in the part of your abdomen here. And insulin is to control your blood sugar since you have type 1 diabetes. Is that okay with you? Yes. Now, I'll just perform hygiene. Now, assist the client to a position in which the arm, leg, or abdomen can be relaxed, depending on the site to be used. Best site could be the outer aspect of the upper arm, abdomen, just below the costal margin to the iliac crest, and the anterior aspect of the upper thigh. Expose the potential injection site and check the area for any bruising, inflammation, or edema. Palpate the site and avoid areas that are tender. Feeling any pain right now, ma'am? No. Alright, so I just want you to relax your abdomen. Now apply clean gloves. Now clean the site using an antiseptic swab in a circular motion. Now pull the needle cap and hold the syringe in your dominant hand by holding it between your thumb and fingers. And using the non-dominant hand, pinch or spread the skin at the site and insert the needle quickly and firmly at a 45 to 90-degree angle using the dominant hand. Pain is minimized by inserting the needle without hesitation. Now withdraw the needle. When the needle is inserted, rest the non-dominant hand to the barrel and move the dominant hand to the end of the plunger and slowly inject medication over several seconds while holding it steady. Now, I'll place the swab on the side. And apply gentle pressure, but don't massage the area. And if bleeding occurs, apply pressure to the site of the dry sterile box. Now assist the patient into a comfortable position and flip down medication thickets. Remove gloves and dispose of used items in appropriate waste receptacles to avoid needle prick injury. Now perform hand hygiene. And document the procedure, including the medication given, dosage, time, route, and any assessments. the effectiveness of the medication at the time it is expected to act, and document the results again. The last procedure is the intramuscular injection. It is the introduction of medication deep into the muscle tissue, wherein a large network of blood vessels can absorb it readily and quickly. Before anything, check the doctor's order for the patient's chart. So, good morning, ma'am. I am Physician Jamie, your student nurse for today. So, before anything, can you state your complete name and your location, please? Alright, so today I'll be administering an intramuscular injection. So your doctor prescribed you morphine sulfate to alleviate your feeling of pain. Okay? So select appropriate site for injection. Vastus lateralis and deltoid muscle are possible sites for intramuscular injection. Examine the integrity and amount of patient's muscle mass and palpate the muscle area. If there is tenderness, then it is not a suitable site for injection. Inspect areas for bruising, inflammation, and edema. Use other sites if present. Now, assist the client to a comfortable position that will accommodate the injection site chosen and expose only that portion of the body. Ma'am, when you sit down, back a little. So my patient is now in a sitting position. Now perform hand hygiene. And apply gloves. Use anatomic landmarks to find the site again. For your deltoid injection, the first landmark is the acromion process. And you're going to go about 2 fingers width down from that area. And now, once we have the area, disinfect the injection site in a circular motion. Hold the gauze pad between the third and fourth finger of the dominant hand. Then uncap the syringe and hold in between the thumb and forefinger of the dominant hand. Now prepare the syringe for injection. To give the injection, what we need to do is we're going to use the C-crack technique. What this technique does is, number one, it decreases pain for the patient, but it helps prevent the solution that we're instilling from actually going in that subcutaneous tissue. Now, we inject quickly. When we inject quickly, it causes the patient less pain. So we want to steady our syringe by holding it steady with our thumb and forefinger. Now, aspirate the syringe by pulling back the plunger with your dominant hand to determine if you have hit a blood vessel. Now inject the medication slowly in about 10 seconds per ml, and wait for another 10 seconds to let all that fluid go down into the muscle. Now smoothly withdraw the needle. And the same angle we had inserted it. Now place a gauze or cotton swab over the injection site, applying gentle pressure but not massaging the area. And if bleeding occurs, apply the pressure with a dry sterile gauze and let it stops. time, we discard the uncapped needle and attach the syringe into the proper receptacle. After that, remove and discard gloves and perform hand hygiene. Place the patient in a comfortable position. Now, we document the procedure, including the time of administration, drug name, dose, route, and the client's reactions, and assess the effectiveness of the medication at the same time it is expected to act. So, ma'am, we are done now. So, with the intramuscular injection, so I'm gonna head out. So you can take a rest here. So, I just want you to avoid massaging the area that I have injected with the medicine. So, thank you for your cooperation.